Okay, so I'm going to be recording on this clinical decision making section. I have another one I'll be recording after it on the nursing process, helping you take this information and then bringing it into your concept map. So, what is critical thinking? You have a problem, you think about it, you come up with a solution. It involves deliberate thinking, nonlinear, not that this follows this follows this. You can be going in multiple directions at the same time, collecting, interpreting multiple aspects of data, coming to a conclusion, presenting it, evaluating factual and belief-based information. That is your nursing process. Decision making helps nurses make decisions. When they do not have enough clinical experience or knowledge to make these decisions, they use guidelines to help them, or I call them algorithms all the time. If this is this, then I do this, then I do that, then I do this. And that is what we're trying to teach you with your concept mapping. Many clinical situations involve alternatives to be considered before taking action. You have to think about what you can do, what the alternative is, if there is one. And whatever you decide, you have to think beforehand of any adverse consequences on whatever decision you make. There's not always just one best answer. So you have to think about what's going to be best in that situation for that patient under those circumstances. So the nursing process, which you've talked about before, I'm going to talk about again in the next lecture after this. 5 steps: assessment, nursing diagnosis, planning, implementing, evaluating. So you gather your information about their condition, you identify the client's problem, you plan by setting your goals of what you hope to achieve, you implement them, and you evaluate whether that was achieved. So nursing assessment is the art and science of truly seeing a patient. Nursing is both an art and a science. We talked about that in fundamentals, because you have to use science and evidence-based and pharmacology, pathophysiology, biology, anatomy and physiology, but also look at them as a whole person. So it's using subjective and objective information. So the assessment process: collection, verifying the collection of information or data, organizing it, interpreting it, and documenting. The nurse uses a written or computerized format that organizes assessment data systematically. You have to have a system to what you're doing. And again, the concept map is to help you organize. Your diagnosis: there's different types. I'm going to go into it a little deeper on the next recording, but domains of a nursing diagnosis include only health states that nurses are educated and licensed to treat in their scope of practice. Keep that in mind, because your nursing diagnosis isn't diabetes, because you're not doing anything about their diabetes. You're not diagnosing the diabetes. You're not treating the diabetes. What you're doing is an alteration in metabolic process or impaired metabolic process. That's what their diabetes is. And so their alteration in metabolic process, as evidenced by a fasting glucose of 300, related to impaired glucose metabolism, or something like that, or obesity, or something. So your interventions would be administering the medications, teaching them about why they're taking the medications, teaching them methods to change what they're eating, those sort of things, and then evaluating with their glucose and with their knowledge and different things. So that's the nursing process. Okay, planning, deliberate, systematic phase. You have goals, that need to be observable patient responses, what you hope to achieve. If you can't measure, you can't see it, you can't evaluate if it happened. So when you plan, you're planning, this is what I hope to get to. This is my goal in the end. And then you do plan your interventions around that. So goals are specific, achievable, specific, measurable, achievable, realistic, timely, or have a time frame. They have to be patient-centered, because this is about the patient. It's not about you. It's not about someone else. It's specific for that patient, for their problem, and you collaborate with the patient what they hope to achieve. Specific, concise, single actions. Directional for nursing interventions. You need to know what you're going after when you're doing your interventions. What you have to have a goal in mind, an outcome in mind. Quantifiable, measurable. It can't be, it's going to improve. Well, how do you measure improve? The glucose, fasting blood glucose is going to decrease from 350 to 250. Realistic, can you really get them down 100 points, or do you need to go 350 to 300? If it's just on your shift and you're making goals for your shift, it would be more along the lines of patient able to demonstrate, injecting or drawing up their insulin, or able to state the reason they're taking it or the times they're taking it. It needs to be in the time frame that you're there with them to be able to evaluate, this is what I see, this is where I hope to get before my shift is over, this is what I'm going to do to get them there, and at the end, okay, I measured it, did they get there, did they get partially there, did they get completely there, or did we go nowhere and have to go back to the drawing board? Implementation, ready, set, go. It's putting things into place, what you had planned to get to. Direct and indirect. Direct care interventions performed through interaction with the patient. That would be your direct teaching, administering medications, skin care, teaching them wound care, doing wound care. Indirect care, intervention performed away from, on behalf of the patient. You're getting a consult, you're talking to a dietary about it, maybe you're speaking to physical therapy, you're talking to a home care when they're going to be discharged, something like that. Okay, so that is the end of this recording.